Welcome back to this special edition of NCBA's Cattleman to Cattleman as we hear from the animal health experts at Mariel. Gentlemen, we've been talking about BRD. I want to talk about treatment for just a moment. And Dr. Van Dyke, tell us, what are some of the antibiotics that are available for treatment?
Kevin, there are some very good antibiotic classes that producers and veterinarians can choose from these days, a lot more than in my early practice years. But they would fall into the classes of the macrolides like Zactran, the fluoroquinolones, the beta-lactams, and the chloramphenicol type drugs.
You mentioned macrolide, and I've heard that term used before. Tell me, what is a macrolide?
A macrolide is probably the newest group of antibiotics that we've got on the market today. They're a class that incorporates a high intercellular concentration once you give it, and it sustains itself over that concentration over a period of time. So the thought and the theory is once we treat them, we don't have to keep re-pulling them day in and day out, and it's better cattle handling for the producer.
So Dr. Van Dyke, what is Zactran, and exactly when was it introduced?
Kevin, Zactran was brought to market in 2012 by Mariel, and Zactran is a macrolide, but all macrolides are not alike. Each molecule is different. So macrolide Zactran is a novel molecule in the macrolide class, and they vary in how well they get to the site of action, and they vary in how well they act once they get there. So that's how different, even though they're in the same class, they might behave differently in the animal.
So you said it's a novel in terms of how it reacts. Dr. Moravec, tell us, how does Zactran work?
Well, Zactran as a macrolide works within the white blood cells. Of course, animals, people, we all have red blood cells and white blood cells. Red blood cells oxygenate the body, support organ function. White blood cells do pretty much everything else. They're involved principally with immunity and then also disease protection and neutralization. So Zactran gets into the white blood cells and is able to go to the site of infection, in this case BRD, gets into the lung rather quickly, and within 24 hours we can have a real positive response as a result.
In fact, we have a short video that provides additional insight on how Zactran works. Let's have a look.
In the treatment and control of bovine respiratory disease, BRD, rapid response is critical. Zactran is a novel subclass of macrolide with a structural difference. Gamithromycin, the patented active ingredient in Zactran, is rapidly absorbed, extensively distributed in lung tissue, and persists at high levels for an extended period. After subcutaneous injection in front of the shoulder at 2 milliliters per 110 pounds, Zactran is rapidly and completely absorbed. In the blood, Zactran exhibits low plasma protein binding, resulting in 74% available free drug. Moving with the bloodstream, Zactran rapidly reaches the lung within 30 minutes after injection, where it can diffuse out of the capillaries. In the lung, at the primary site of infection, it quickly accumulates in the pulmonary epithelial lining fluid, or PELF for short. Zactran concentration in the lung rapidly rises above the minimum inhibitory concentration, MIC 90, within 30 minutes and peaks in 12 hours. Zactran concentration levels in the lung remain above MIC 90 for 10 days. BRD infections occur at the epithelial lining in the lung. Zactran accumulates in the white blood cells and in the epithelial lining fluid, where the bacteria are trying to colonize. Zactran is present where it counts, ready to attack the pathogens and to exert its bacteriostatic and bactericidal effects. Gamithromycin concentrates in the lysosomes of immune cells and travels with them to the site of the BRD infection, attacking bacteria as they are engulfed or releasing drug into the PELF. In field trials, clinically ill cattle treated with Zactran showed rapid improvement in BRD clinical signs. Most cattle with a body temperature over 104 degrees Fahrenheit showed a significant decrease in fever within 24 hours post-treatment. Respiratory character scores and depression scores also decreased within 24 hours post-treatment. These results were maintained for the 10-day study duration. In further clinical studies investigating control of BRD in high-risk cattle, Zactran provided effective BRD control throughout the 10-day study. Zactran by Merial. For a rapid response, 10-day treatment and control of BRD in a single dose.